It's called Here's to Your Health. And joining us now in the Zoom room is Dr. Kelly Neal. Good morning.
Good morning. Merry Christmas.
Merry Christmas. So I believe we are talking about Medicare annual wellness visits. Tell us about that.
Okay. Just before I go into that, let me just specify what my job is.
Okay.
So my job at AMC is to make sure all of my patients have every benefit Medicare has to offer. Mm-hmm. So that's my job. So when I tell patients, they go, sign me up. I mean, I want that. So the interesting thing is one of the benefits is called an annual wellness visit. And so that's for us as providers to take an inventory of the patients, all their social economic elements, their physical elements, all their medications, and we put a risk assessment together. It gives us an opportunity to kind of get down into the weeds a little bit more on the patient, and rather than these 15-minute come and go elements, we look at all their medications, make sure that they could be on the best medications for them at that time. It also we also do a advanced care planning. That's where I have to talk to him really carefully and say, in case your heart was to stop, do you want a full resuscitation? Do you want a breathing tube? Or do you want a peaceful passing? And kind of make some recommendations there. And I actually fill out the legal form for them to take home with them, because having the form is the most important thing. And that's basically, in a caveat, what I do for the annual wellness. It's a free visit. It's done every year, and Medicare pays for it.
I have so many questions. I'm actually recently a Medicare recipient. I just got mine. I have so many questions. My social worker has been great about answering them when we started the process. So for those that are new to Medicare, like myself,
congratulations.
What are some of the bigger things they need to know going into this?
Good question. I think I get that booklet every year that says Medicare of the Year. And then so often we have this discouragement because it's offered in the States, but Hawaii, but not Guam. So often they want to know, what do I get? I paid into for this for a lifelong. I want to know, what is it for me? So the questions is, to be honest, is more specific to the individual. Are they more interested in the medication cost? Or are they more interested in DME, which is like walkers and wheelchairs? But the annual wellness, circling back to that, is specifically for health management. And that is to keep, say yourself, here with us as long as possible. And that's where
I plan on sticking around for a while. So
yeah, I'm surprised you actually Medicare. You look young. So that's what that wellness centers on, is that health risk assessment, and look at the cardiac element, the Alzheimer's element, depression screening, which is kind of a hard one to do right now because there's a lot of people that are not in their best of mood. And what can we do as a provider? What can we do about it?
I wanted to ask, with Medicare, the benefits, you know how like the tax code will change from year to year? Oh, there's a new law, so this year the laws and taxes are a little different. Does Medicare kind of change as far as coverage goes from year to year? And do people need to kind of re-up their policy, so to speak?
The Medicare, what they cover, traditionally, it does change. There's a little nuances that change every year to year. The original question is, do you as the patient have to do anything? No, the patient doesn't have to. If you, let's say Medicare D is for all the pharmaceuticals, and you decide that wasn't the package you got initially, but yet you want it after like 5-10 years on Medicare because the medications start being expensive, then you can contact Medicare and say, hey, I want to add this sunroof to my car. Meaning you bought one package and now you want to add to it. And you certainly can do that through the time frame you have Medicare. Absolutely.
Okay, because I needed to know that too, because I have Part A and Part B. My kidneys failed this year. That's why I'm on Medicare. So
I'm sorry.
So I have A and B, and is there like an open enrollment for D, or can I just, I need to tack that on because one of my medications is $400 every prescription refill.
Yeah. And there's kind of an element of an open enrollment. I'm fault by not knowing exactly the phone number to give you on that, but you can reach out to me. I can certainly help you. I work very closely with the social service chapter here on Guam that have free services to the patient, even clerical, to help to fill out all that paperwork, the forms for, like, say, Medicare D, and any questions, and even some billing issues that they may have had. And that's a great service that the social service organization have. They have volunteers that will help the patients.
Yeah, the social worker I've been dealing with, they've been great, but it's one of those things, there's so much to this that is, even though they've answered every question in that session, as soon as I get home, I'm like, wait, I need to know this, I need to know this, I need to know that. Yeah.
And they're gonna come forever. They really are. And the goal is that you're going to be around for a while, so you're going to have those questions that come up.
So for those on Medicare and do want to take advantage of this yearly annual wellness check, how do they go about doing that?
I do them all the time. So, obviously this is going to be for AMC. Let me get you that phone number. You'd think that I'd have it memorized by now, but I actually had her sent to me. Hold on just a second. And that number is not my mom.
You call mom when you have questions.
She was the one that just last texted me. The phone number is 648-9110. Again, that's 648-9110. And so when they call the office, it's very simple. Just say, hey, I want to book an appointment with the Medicare provider. I got a great staff. So please don't think that I do this job alone. I've got great staff that help me to do it. And maybe another time we'll talk about other programs that Medicare has to offer. But for the annual wellness, it's usually about an hour, 45-minute visit to get to know them, because I got to tease in all their records. You have
to review their records, just like a primary physician. You have to kind of know, allergies and their condition and things like that.
Yeah. And then things that they may not have even thought about. Hey, do you really need what can I do, like, for someone that is disabled? Do you need a handicap placard? Those things really make a big difference in their lives, just for convenience sake. And Medicare will take care of it too.
And you're going to get your car serviced frequently, so you need to service your Medicare as well.
I know. The only thing I know how to do with my car is put gas in it. And damn it, things are breaking down all the time. And I don't have that talent. But I respect people that do. So if people actually think of what I do, I'm the mechanic of a body. The body is so wonderfully, uniquely made. It's really not different than a car. It will break down, and there's things we need to do to keep the longevity of it. But I'm truly just a mechanic of the body.
Yeah, I plan on putting a lot of more miles on this chassis. So
good.
I appreciate what you do. Thank you very much for joining us. Bree, did you have any questions?
Yeah, I did want to ask, because you were talking about making these appointments and coming into the clinic, but do you offer appointments like over the phone or via Zoom, or do people actually have to physically go in? And
Hey, great question. One of the benefits, if I could say that, cautiously, of the COVID is that Medicare now pays for telemedicine. We've been waiting for that for a long, long time. And at this time, they will still honor it. So good question, and I failed to bring it up before, is I can see patients on the Zoom. Absolutely. The problem with the Zoom is I can't put my hands on them. So there's no physical component, which may not necessarily be necessary, but I at least get to go into their medical history and the question and answer period. Absolutely.
Also, you were talking about those end of life type of conversations that you talk with the patients. How difficult is that? And have you seen, I guess, an increase in people visiting because of the pandemic?
So several questions. How difficult is it to have that conversation? And have I seen an increase? I don't know if you recall, I actually did a whole piece on your radio show on advanced care planning. And it was well received. I think because one of the things that I have no idea why, but I have the ability to talk frankly and honestly with some of these patients, say, hey, what are your desires? What do you want? And I can say, hey, this is a best case scenario and this is a worst case scenario. Because being in this field for as long as I have, I'm old. So I have a lot of stories to bring forth that they would have never really thought about. What is prevalent, though, is they don't want to be stuck on a ventilator. They don't want to be stuck on a breathing tube, and they don't want to have no no quality of life. And so if that's it, then we tailor that medical form, which is a legal form, to what, God forbid that happens, so that their quality of life is preserved. Have I seen an increase? I think some of the increase may be out of fear. Some of the increase may be out of the nuances of it, because it really hadn't been approached here on this island prior to the wellness visit. And some of it was probably because they know what they don't want to have happen, because this visceral response of the COVID, they know they don't want to have that happen to themselves. So they're being plain and appropriate.
Okay. Jason?
Dr. Neal, this is Jason. Hi, thanks for joining us again. We have a comment here from our Facebook live stream. Bev Tess J is saying, are you able to address the availability of medical equipment on Guam, which can sometimes be problematic, and where do you go if you're having a problem getting, specialized gear, like obviously like certain types of wheelchairs or hospital beds for the home, or oxygen,
or a peritoneal dialysis machine?
Yeah.
We don't have those. You are very correct. The question is that what about the DME, and have I seen a difficulty in getting some of the things that I think the patient need? Yes. Yeah, I do. So, for example, CPAP machines. We've got so many patients that have obstructive sleep apnea and need the machines, where if you're in the States, Medicare will give it to you. Here, for reasons I don't know, you have to rent them. And then what happens if you don't rent it from this company, but it breaks and you have to get another machine? So have I seen it? Absolutely. I think that's definitely a medical necessity, is that they need the CPAP machines. What is often difficult in my position is thinking, yes, I do think that they would benefit from a hospital bed, but will Medicare pay for it? So Medicare has strict guidelines on some of the DMEs, like the hospital beds and the wheelchairs. So going through the letter of the law so that it never comes back to the patient. Not everyone needs a hospital bed. Yes, it's convenient, but will Medicare pay for it? And so there's that guidelines.
Okay. All right. Thanks a lot. Thanks a lot, Doc. Any final comments?
You're welcome. Merry Christmas.
All right. Merry Christmas.
Merry Christmas. Thank you.
Thank you.
You're welcome.
Again, the number is 648-9110 for the American Medical Center. Any questions that you might have about the Medicare annual wellness visits. Again, 648-9110. And that was